Hello, and welcome to the Doc Talk, a podcast in which we talk to doctors about their trailblazing careers, their professional and yes, their personal experiences. I'm your host, Mian. So this is our first episode, and I'm super excited to welcome our guest, who is a pediatrician by training with fellowship in infectious diseases, and then made a name at national level in quality. He's also the vice president of quality and safety at Arkansas Children's Hospital, Dr. Jared Capuya. Welcome to the Doc Talk.
Thank you, Amir. Thank you very much for having me.
Let's start. So, Jared, you've had an illustrious career and have seen transitions, and I'm sure it will help our trainees and younger graduates who may have an interest in additional professional pathways. So, when did you make the transition to quality and safety? And if someone is interested in this pathway, how should they proceed?
Yeah, it's a great question, and thank you again for having me and the kind introduction. I as you said, I was trained as a general pediatrician, ended up going into hospitalist medicine in 2007, and really had no intention of going into quality or safety at that point in time. But after probably about a year or so in practice at a medium-sized children's hospital in the Puget Sound region in Washington State, kind of realized, we weren't practicing evidence-based medicine all the time, and we were a lot of variation between how we were caring for patients from an individual perspective throughout our practice. And so just sort of naturally gravitated to sort of clinical effectiveness and outcomes. So really looking at how could we create evidence-based pathways for the common things we took care of and start looking at, the outcomes from that standardization, including creating a lot of dashboards to really create visual displays of data to show, once we all started adhering to whatever that best evidence was or guideline, how are we actually, were we actually making an improvement in the care? Were we actually leading to decreased costs? Those sorts of things. So really it was one of those things as a hospitalist. I think you have that vantage point of you kind of see the whole care continuum from kind of outpatient all the way to when you discharge them back to outpatient. And you can see kind of all the variation of things that happen in between. And I think that's really what got me kind of really interested in quality, and it was more that clinical effectiveness to start. And as that grew, I was in a healthcare system that's 8 hospitals big. It was mostly adult focused. We were the only children's hospital in that system. So after a couple of years of doing that work in hospital medicine, ended up getting a leadership position within the hospitals group, so helping to co-lead that group, really focusing on quality. And then probably a couple of years thereafter, really started getting, so we were talking about 2010-ish, 2011, really starting to work for the system. The system was coming to us and saying, hey, we need system objectives, we need system goals around quality that are relating to pediatrics. We are rolling out a new physician compensation plan, and they needed someone to really manage that on the pediatric side from a resource utilization, quality, patient experience perspective. And so I really got probably self-taught at that point, really learning how to create measures or look to what measures were out there, adapt them to what we were doing at the children's hospital as well as the ambulatory space, and really just started learning quite a bit, and was very fortunate in 2012 that our children's hospital got named top children's hospital by the Leapfrog Group. So we were one of the top 12 children's hospitals in the country, and that allowed me to then get some more FTE essentially. So I was about 20% of my time spent on that, although as most people know, when they have a little bit of FTE that's administrative and majority clinical, it's not 20%, 80%, it's more like 50%, 80%. And so I ended up getting that up to about 40% and took the first position in that children's hospital as a medical director of quality. We also onboarded into Solutions for Patient Safety in Wave 3 in 2013, so a couple waves behind Arkansas Children's. And was really responsible for getting us onboarded into that process as well, and then setting really the strategy for quality and safety from that point forward for that particular children's hospital. And so it was kind of this slow progression from 20% to 40%. And then over time, that grew to 60% because of how much time it was taking to manage all of those things, whether it was the physician compensation plan, the system goals, and then eventually getting more into population health and those sorts of things. And as that time grew, I realized, hey, I probably need to go get an education in this, right? I was sort of self-teaching myself at the time. I had done IHI Open School. I had gone and gotten a yellow belt in Six Sigma and a bunch of other certificates, but I was like, I probably need some formal education. So I enrolled in Thomas Jefferson University has a master's in healthcare quality and safety management. And although it took about 4 years finally completed that and really kind of formalized my education. And then as I was ending my time at that particular children's hospital, I took on a chief medical officer role in addition to the quality role and became 100% administrative. So about the past 3 years or so, I've been really 100% administrative in the quality space. I would say for anybody who's really interested in this as a career, especially for trainees or students, is really starting to look for where do you see the problems, or where do you see the opportunities for improvement in your kind of daily work that you're doing, right? Everybody sees them everywhere, right? And it's just a matter of, I want to define this one little problem that we're having. How do I then look at that, and what kind of tools can I then apply to make that better, and then scale up from there? I think we all should probably be teaching those skills every day to our trainees anyway. Just, hey, this is how we do things, but this is how we could do them better potentially. And that could be from a clinical effectiveness standpoint. That could be from a patient safety standpoint. There's so many different ways we could approach, improving care. But I think for people who might be just entering medicine or who are interested in this, it's just kind of like, look at your local problems, figure out how you might want to apply some of the QI tools that are out there to solving them, and really just start there and then build up from there. And I think most people will either be really interested in that, or they will not be interested in that, and they might want to pursue that further as a career.
Absolutely. Awesome. No, that's great. I'm sure the audience, especially the trainees and the young faculty, they would find it extremely useful. So, even in the last 7 to 8 years or so, we at Arkansas Children's have seen a lot of emphasis on quality and safety. So if there's somebody from our team who may be interested in quality or in safety, and if they've got a great idea, how should they proceed? So how do they sort of get in touch with your team, and how does that help?
Yeah, I think the first thing, and maybe the best thing to do up front, is if again, they identify some improvement idea, project, whatever that might be, is really start on their own to define the problem that they're trying to solve, and really try to figure out or justify that that's a real problem. So in other words, like if I'm going to make this really simple, if this microphone wasn't working, that's a problem. And then I would want to ask, well, why is that not working, right? I'm going to go see what's going on there. It may be that it's not plugged in. So I'm going to see that it's not plugged in. I can solve that problem very quickly, right? And so the same thing, if one of our trainees or one of our faculty members, has an interest in a project or identifies a problem, the first thing I would do is just go validate that what they think is a problem really is a problem by going and seeing and asking those whys, trying to get to that root cause of what's causing that problem. And then applying like Model for Improvement or one of those easy tools that they can get from IHI or other places to start working through, plan, doing, studying it, adjusting. So hypothesizing, hey, if I plug that microphone back in, it's going to work. Well, what if I plug it back in and it doesn't work? Then I got to go back and look and refine my sort of hypothesis as to it's probably something else, right? And I got to get to the bottom of that. And then I can hypothesize, well, if I do X, then maybe it'll get better. So I would start there. And then as the problems get larger or bigger, engaging our team, engaging the quality safety team. We got some really talented individuals in process improvement and quality risk and safety. So from the patient safety side, from the quality side, as well as infection prevention and even simulation, which is a great asset to have for quality. Engaging those teams and thinking through, like, here's what I'm dealing with, here's my problem. What are some other tools potentially? Because I think Model for Improvement is one way. It's a good way to start, especially with small scale sorts of change. What are the other tools available to us, and what can I look at to potentially make this into a larger project or really influence change on a bigger scale? And I think, when you go back to that first question you asked, I think that was part of my journey too, is, like when we were working on pathways and, changing one thing at a time, you eventually get to see how your small changes affect larger change. And I think that's one thing that could be very influential to somebody, especially a trainee, is when they're seeing that hey,
right,
like, I could really influence a system.
Absolutely.
Here. And I think that's really great.
In your first answer, you talked about training and population health, and obviously that's the new sort of paradigm in healthcare, and that probably explains. So you're also the medical director of the Arkansas Children's Care Network, which is overseeing our transition to value-based care. So could you tell our audience what's the importance of value-based care in our health system, and why should we care?
Yeah, no, that's a great question, and I think historically, if you go back and look at how medical care is delivered, very episodically, right? And we get paid per episode. So we're really good at fixing and healing people who are sick, and we get paid for that. And the more we do it, the more we get paid for that. So we're sort of incentivized on episodic care. And I think where value-based care comes in, I think the idea is that we then take that model and say, if we actually look at trying to keep people healthy, and at its root, the value-based care is what it really means is that we're providing better care or higher quality care at a lower cost, right? So it takes that previous sort of fee-for-service model, or that model where we're just kind of episodically treating something and saying, can we keep a whole person healthy, and can we do that at a lower cost? And can we do it and provide a really great experience for that person as well as the person providing the care? I think that's kind of at the base of it. And then obviously there's now models of payment that are sort of forcing us in that direction, so that we actually then look at primary, secondary, tertiary prevention and how we contain costs.
So obviously, so the value-based care is, from what I understand, is going to define how we deliver care in the years to come, and then down the line. This is probably the only sustainable model, with probably some combination with other incentives to sort of sustain it for the healthcare. So on a different sort of note, social media. Are you active on Twitter and LinkedIn? And if someone were to follow you, I mean, how do they find you on Twitter, for example?
Yeah, I'm probably not as active as I should be. I do have a Twitter account. It's just at Capuya, Capuya, and I'm on LinkedIn. But I can't say that I'm a uberly active tweeter or very productive on LinkedIn, but I do go on there and I do look around a little bit. I think you have to be cautious with social media a little bit.
Yeah.
But yeah, I am on those.
And platforms. I do follow you at Twitter. So
great.
So if you have free time, what do you do for fun, especially in this age of social distancing? So tell us about your experiences.
Yeah, so one of my favorite things to do is go cycling, and I try to at least a few times a week go down the Arkansas River Trail.
That's a great
I'm
track.
Very thankful and grateful it's still open,
yes.
And you're able to certainly social distance on a bike, and that's something I try to do regularly, which is a lot of fun. The other thing we like to do is go camping. Got a little camper. We try to hit all the state parks and other various parks and camp, and we're an outdoor, my family, we're an outdoors family, so we love to do stuff outdoors and travel. Yeah.
That's great. So so in this this day and age with COVID-19 all over the place, so which is probably the biggest challenge of our times. So as we struggle to find a new norm, with your training in hospital medicine, pediatrics, infections, and obviously quality and safety, I think you were probably born for this moment. So, in your view, what are the top 3 challenges that you think that we need to deal with within the context of obviously COVID-19?
Yeah, no, I think that's a really great question, and I tell people all the time, I don't think anybody alive today has probably ever experienced anything like this, and like alive today who works in healthcare has probably experienced anything like this. It's truly challenging. So the first thing I would say is just really trying to stay ahead of all the changes and recommendations. I think because we know so little about this virus and how it's transmitted, and sort of data coming out of other countries, which we have to take with a little bit of a grain of salt, but is very helpful. What we are getting is that it's really hard to take that information, sort of synthesize it into something to make sort of reasonable recommendations or pathways to sort of proceed. So I think staying ahead of that information and trying to learn it as it comes out is very challenging. You almost need someone just dedicated to reading everything that comes out every day. And as you know, I mean, people have cited it takes 17, 18 years for evidence to get into actual production. So we're talking about taking something that comes out today, and by tomorrow we're doing it. So that's a deviation from what we normally do.
So true.
Making best decisions. I think one of the biggest things that we have faced is making decisions like in shades of gray. So in other words, Dr. Mian, you could test positive for COVID, and then we go and we do contact tracing. Who have you been around? What patients have you seen? And we're making decisions on who stays, who goes, based on just slight differences in how someone might have been around you. Or with a patient population, we may or may not contact families and let them know because we have such limited resources based on the time they spent with you, or were you wearing a mask? We're making these decisions. We're hoping that we're making the right decisions, but they're just shades of gray. They're not, I always keep saying we're making the best, worst decision all the time. And then the last thing is just really committing to resilience. I think we try to build our system where there's redundancies, and we try to build a system where if you happen to have to be quarantined for 14 days, there's enough staff to fill in. If your nurses, go out, that there's enough staff to come in and help with that. So I think that's the other challenge, is just how do we continuously have that commitment to resiliency over time when we keep getting hit over and over and over again. So I think those are very tough.
Okay. So no, that's great. So so resilience. I mean, that's sort of the key to resilience in system, and obviously resilience in the medical professionals, right? So I mean, burnout. We've had burnout in the medical community for even before the COVID hit us. It was at historic highs, and with all the stresses and strains of working in such a sort of a challenging sort of environment. So I know you've had interest in physician wellness, and burnout is something that I personally sort of worry about because the concern is past COVID we're going to tax our system, and we're going to tax our medical community and the professionals to the greatest sort of strains that we have never sort of experienced before. So any ideas how we might deal with burnout, and how do we bring joy to our daily lives when we know our lives are so stressed out?
Yeah, I think this is a very hard time to do that. I mean, there's a few that come to mind, and one is it's probably cliche, but we have to take care of ourselves first, right?
Yes,
so
absolutely.
I think as healthcare providers, as people who work in healthcare, we always look at everything else before we tend to look at ourselves. But I think in times like this, it's probably you should flip it a little bit, and don't feel guilty for going out and getting exercise or trying to eat the right things, or spending time being present with your family. I think those are all important things that need to be done. The other thing is, that I've noticed over the past few weeks is no matter what your background is, as a vice president of quality and safety, I've been thrown into so many different situations where I just have to be a leader, and it doesn't matter that I'm quality or safety. The stuff that follows your name doesn't really matter at that point. So I think it's an opportunity to embrace, meaning in your work. I think part of not burning out is finding a lot of meaning in what you do every day. And I think we all probably, and I'm sure you do, find meaning in the work that you do every day. But I think this also presents opportunities to do different things. So Are there other ways that you could potentially help? Are there other ways that you could pitch in different areas, whether that's in the ER or other places? So I think there's a different way to find meaning potentially in what you do every day, or why we went into healthcare in the first place. And the last one is, I know you asked about social media earlier. I think from my perspective, you got to put it down sometimes. Depending on what field you work in, you have to kind of put that down, because I think sometimes you start believing it a little bit. So I think that's the other thing in terms of resilience. And for some people, it might not be social media. It might just be the news. It might be, other sources that just stress them out. So I think it's okay to just tune that stuff out for a while and really just have like tune out time, or, kind of go out and do your own thing without plugging into the world for a little bit. So I think those are all helpful too.
Yeah, I think this, sort of shutting off from the world is sometimes really helpful. I mean, when this COVID crisis started, we were all sort of into news from one channel flipping into another. But now, from 6 to 8, for example, there is no TV. There's other stuff, movies and stuff. And I thought that it has brought some peace and sanity to my household, which is certainly great. So, well, Dr. Capuya, thank you very much for your time. Well, this podcast has been a team effort, and my colleague Justin Criddle and I are thankful to all our audience for listening. Please subscribe. We believe you'll find value in this podcast, which is unique to highlight diversity in physician professional careers. We promote collaborative research opportunities, and above all, this is yet another venue for us to stay connected in this age of social distancing. We will see you again next week. Be well, stay safe.